to answer some of your medical questions, and joining us with the answers, as he does every Wednesday, is News Channel 5's medical specialist, Dr. David Soria. When he's not here with us, he is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks for stopping by.
You're welcome. Good to see you.
Our topics today, very appropriate for the noontime, lunchtime hour, because they all deal with food. So we'll start with this. Can overeating in older adults lead to memory problems?
You know, it's fascinating data because this is just out, and really what Mayo researchers looked at was elderly patients, in particular 70, 80 years old. One group ate a high caloric diet, another group ate a low caloric diet, and then they compared their memory. And what they showed was the patients that ate the high caloric diet had twice the possibility of getting what's called mild cognitive impairment or early dementia. So the jury is still out. It's way too early to say. But one thing's for sure. We know that overeating causes and can contribute to stroke, coronary disease, hypertension. So clearly it just goes to show that a disciplined diet throughout life is very important. And this is just another factor to consider when it comes to overeating.
That's interesting. So staying fit and trim helps everything.
You bet.
Throughout all life.
And you'll remember it too.
There you go. Touche. All right, the next one. Speaking of our memory and our minds, why is fish called a brain food? You know,
there's a lot of things out there that they're considering brain foods, and fish seems to be one of them for a particular reason. The brain is made up of fatty acids, and particularly polyunsaturated fatty acids are what contribute to the viability of brain tissue. Fish are high in omega-3 fatty acids because they eat algae in the water. So presumably, you eat fish, you get the omega-3s, it's healthy for the brain. Now, there's studies out right now, so the jury is still out to really know whether or not there truly is a benefit. But just like we just spoke about, we know that omega-3s are very protective to the heart. They prevent stroke. They're good for prevention of heart disease. So again, just another reason to eat up food that we know is good for you. So there hasn't been any negative press on fish. So again, it sounds like it's beneficial. Also, Japanese who eat high amounts of fish have the lowest rate of depression. So again, we're thinking there's probably a correlation there, right? So eat up your fish.
Well, we're nearly out of time, but if you're not a fish fan or you just don't like to cook it, is an omega-3 supplement the same, or is eating the fish really the best?
All right. Most experts would say the natural fish is best, but clearly a supplementation is going to be beneficial as well.
Better than nothing.
You got it.
All right. Great advice as always. Thanks, Dr. Soria. If you have a question for him, just we'll get it to him. We promise. Right at our website, WPTV.com. Just click the health link, and we'll see you right after the break.